and good evening. I'm Melissa Idris.
And I'm Sharad Kutan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Let's begin the show with conversations around drink driving. Now, there have been calls for stricter laws and heavier punishments against those found guilty of drinking and driving. Former Transport Minister Anthony Loke and other DAP leaders have come forward today to urge the Perikatan National Government to speed up law amendments against drink driving. Anthony Loke said that the plan to amend the Road Transport Act 1987 had in fact been in the pipeline when he was holding the ministerial post. Meanwhile, PAS has called on the government to immediately suspend all productions, businesses and sales of alcoholic beverages so new measures can be taken to prevent drink driving. But I think, Sharad, we really need to take a beat here and reconsider the context of the issue at hand. There are multiple angles to consider, not just that of government responsibility and legislation, but also the responsibility of the personal responsibility and also responsibility of the media in covering this issue.
Indeed, Melissa, you know, around the world, many countries that uphold the right of individuals to enjoy all their pleasures, but within certain limits, especially those pleasures that have repercussions for others. And so, you know, very sensible laws have been passed around the world. So the question is, when it comes to the way in which this issue is being covered in, you know, our local media, there's a lot of, it's very emotive, often exaggerates the extent of the problem, meaning what is the contribution of drink driving to the overall numbers in terms of traffic accidents?
I feel like that context has not been given, also because perhaps the numbers are not readily disaggregated. But you're absolutely right in terms of how the media has chosen to cover this, what is being said, what is being reported, and why certain news and accidents are highlighted more so than others.
Yeah,
I think that's a question we have to pose to ourselves.
Yeah, I think the numbers are out there. The issue really is why push this. Then we look at the past response. It's clearly kind of you know, an overblown response to the issue, wanting to halt all things. But that's much more about their own ideological position, the vision they have for the country, which is more consistent with their notions of a religious life or a state that promotes a religious life for all, regardless of their own personal you know, preferences.
Yes.
I think that the other thing that you mentioned, Melissa, which is absolutely true, is personal responsibility. I mean, to what extent, especially in the days today when we have the technology to call taxis very easily and the costs are actually not prohibitive, why not leave your car at home when you go out to drink and take a you know, one of the e-hailing services available?
The other thing is the legislation, right? So apparently the legislation, the idea is to increase the penalties. So currently death caused by individuals driving under the influence of alcohol is charged under the Road Transport Act, carrying a maximum jail term of 10 years, a fine of up to 20,000 ringgit. There's been talk about increasing that. There's also a proposal to lower the permitted blood alcohol. But the other response can also lie to disincentivize drink driving, can also lie within enterprise. So perhaps, you know, taking a leaf from the page of other countries, we're getting the premises that serve alcohol to limit how much they serve, to practice a good ethics in terms of serving alcohol to those people who are inebriated already.
Yeah, Melissa, you know, we only have to look around the world to see some of the best practices, the forms of disincentives, and also I think along with it, you know, I think there'll be public support for it if it isn't confused with, you know, a conservative agenda that tries to prevent people from living their lives freely. So if you can disaggregate, if you can put aside the ideological agenda that is brought forward by groups like PAS and just talk of the practicality, the pragmatic approach to this, which is seen in many secular countries, I think we have a win-win situation.
Okay, so that's something for you to reconsider tonight. But let's move on to other news. Speaking of PAS, PAS has asked that PKR not contest in the Chini state by-election, which is scheduled to be held on July 4th. Now, citing the challenging conditions for campaigning while under the CMCO, PAS Vice President said, and I quote, that it would be better if there is no contest in Chini to solve the problem, end quote. Now, in the last general election, Barisan Nasional won the Chini seat, and PAS has already said it would fully support BN contesting in that seat. So,
well, it's kind of self-serving, isn't it, Melissa? I mean, oh look, you know, with the drink driving issue and changing legislation, you'd have to have Parliament, because we've not had a parliamentary session that allows for any kind of legislation to be debated, never mind being passed. Now you have PAS advocating a response to a by-election that actually benefits their side of the aisle in Parliament, right? So if the shoe was on the other foot, as it were, if this was a seat that was which the incumbents were from Pakatan Harapan or the Dr. Mahathir faction of Bersatu, would this principle still apply?
Well, how many times are we going to use COVID-19 as a reason to skip democratic processes?
Melissa, I don't think there's going to be an end to using COVID-19 as a way of pushing your own personal political agenda. But it must be said, and we said this before on the show, Melissa, many other countries have both had parliamentary sessions and also conducted elections or primaries, as it happened in the US. And, you know, no evidence has come out to show that, in at least the Taiwanese case, that that this engendered clusters of infection.
Yeah.
So it bewilders me that this is a suggestion being put forward.
I completely agree. And I think, you know, if this is going to be, in fact, the new normal, then I think we should all normalize that there will be changes in our political life, in our democratic life, and we have to get used to that. All right, we're going to take a quick break, but after this, we're going to take a look at the need to prevent COVID-19 outbreaks at high-risk areas such as detention centers and prisons. So stay tuned to consider this. Hello, you're watching Consider This. I'm Melissa Idris. With me, Sharad Kutan. Health Director General Dr. Nur Hisham Abdullah recently labelled detention centres, including prisons, as high-risk areas. Now, this was after 3 immigration depots became the centre of new COVID-19 outbreaks. DG Hisham warned that it was also crucial for the Health Ministry to look into screening every individual currently incarcerated at other detention centres or risk a surge in new cases. Now, have these new high-risk centres been ignored in the public health response for COVID-19? Joining us on the line to discuss this further, we have Tan Sri Zaman, former Director General of the Prisons Department. Tan Sri, good evening. Thank you so much for joining us on the show. Now, I'd like to begin by asking you, what do you make of the Health DG's concern that prisons are also considered high-risk areas for the spread of COVID-19? And given your experience working in correctional facilities, how concerned should we be?
Well, I left the prison nearly 20 years now, but I do keep track with what's the development there. You see, overcrowding is dangerous. In the past, we didn't have this COVID-19. We have other diseases. That too was a threat to us, as skin disease and all that. And then now that this one, this new phenomena, Corona-19, looking at the discussion on TV and reading the newspapers and all that, the chances of transmission is very real, to the extent that we have now got to wear masks, we have to wash our hands, so many do's and don'ts. See?
Yeah. Tan Sri, can I just ask you a quick question around the incidence of tuberculosis, of TB in our prisons? That was a concern. What do you know of why TB found itself present in the prisons and was uncontrollable for some time?
Well, I know that there were cases of TB in the prison, but then You see, when I was there was only one doctor to look after the prison in the country. He's based at Kajang. And then all the other things are being handled by prison warders, who are not medical assisted, but they're trained to look into the problem. It's quite true. There were TB cases before, but if there is sufficient medical officers attached to the prison, I think this problem will not arise.
Okay. Tan Sri, you mentioned overcrowding in Malaysian prisons. Now, I'm wondering, because I've heard medical experts urge the government to grant an early release to non-violent offenders, especially those serving short sentences, to prevent COVID-19 outbreaks in overcrowded prisons. What do you think about this proposal? Do you think that this is a feasible proposal for that?
Violent prisoners are dangerous. Before you say release them within a short time on that, let us be very careful about it. Do we want to see people assaulting others outside just because we want to avoid overcrowding? Do you want to see murders taking place?
Okay.
Do you want to see rape taking place?
What about non-violent prisoners? I mean, would the proposal to release non-violent prisoners to avoid the spread of COVID-19 in prisons, could that help?
That is different. You see, for a long time, when I was there, we were fighting for probation. So these non-violent prisoners, if they show sort of good character while serving in the prison for whatever time, then they could be put on prison. They could be put on prison. They can be put on probation, where you can impose a restriction on that. For example, you can ask them to wear this equipment, to put on their sort of race or something like that, so that we can, let's say, A is supposed to be indoors from 8 to 6 in the morning.
Right.
So,
right, so this would be like tracking devices to make sure that those
Yeah.
on parole or are allowed
Probation.
keep within the conditions, right?
That'll be better, yeah.
But sir, let's look at the question of reform of our prisons. You mentioned earlier that during your time there was one doctor, so on and so forth. Why haven't prisons been upgraded? Why haven't the health services in prisons been upgraded? Is it a question of money or is it a question of political will?
We want it. You see, medical, the doctors are with the Ministry of Health. I am president of the Ministry of Home Affairs. To be honest with you, even the doctors also, when I was there, don't last long because he's alone, confined, more like a prisoner, you know. So it is not very sort of interesting for them. They want a better challenge, I think, outside.
Well, what would you like?
The prison. When I was the director there, we were asking for more religious people to be recruited to teach, to sort of to get the prisoners to pray or to behave themselves, all that. But then there was only one ustad. There was only ustad based in Kajang.
So it's a lack of resources, Tan Sri? Is it a lack of resources that's prohibiting the reform of prisons?
Say again?
Is it the lack of resources that has prohibited the reform of prisons so far?
I don't know. But I think we were given quite a good sort of budget, but that's to cater for the prison by itself, you see.
I see.
As a recruitment of religious teachers, doctors, all these things.
Okay.
I think it is through if religion must be judging that, and then if doctors, the Ministry of Health
Right. Tan Sri, can I ask you, what would you like to see in terms of prison reform? Is it the design of the prisons? Is it the management of the inmates, the protection and the welfare of staff? What would you like to see?
I think foremost, I think you said something about the design of the prison. Make it more less rigid as it has been all the time. And I know I went to America to see the prison there also. They have a very rigid control where you can only bathe at a certain time and how many minutes you bathe and all that. So even the prisoners have to talk nicely to the warders and all that. But in this country, I think our prisoners are quite sort of, so to speak, tame, you know. So much so, when I was Senior Director General, I took a whole group of judges, including the Chief Judge, to Sungai Buloh to show them the condition inside and all that. And then we went to the carpentry shop block where the detainees are doing carpentry and all that, with the hammer, with the axe, with the saw and all that.
Right.
And the former Chief Justice, I accompanied him, approached one man who was holding a hammer to nail something. So the Chief Judge asked him how long he had been here, for what offense, all that. So the man looked at me. He said, ini orang tahulah saya pasal apa saya sini. Actually, he was the leader of the man who robbed our tourists from Serdang, who went to Singapore, stayed in a hotel, and they robbed the tourists. And then came back, and there was a cooperation of Singapore police.
Okay.
I managed to arrest him before he reached Serdang.
Okay. Well, Tan Sri, sorry, I'm going to have to interrupt you because we're running out of time. And I want to thank you so much for speaking with us tonight and sharing some of your experiences as the former Director General of the Prisons Department. Thank you, Tan Sri.
Okay. You're welcome. You're welcome.
All right, after this, we're going to hear from Suhakam Commissioner Gerald Joseph, so stay tuned to consider this. Thank you for staying with Sharad and I on Consider This. Let's continue our conversation about high-risk populations and protecting them from future outbreaks of COVID-19. Joining us on the line, Gerald Joseph, one of the commissioners for the National Human Rights Commission of Malaysia, better known as Suhakam. Gerald, good evening. Thank you for joining us today. Now, I understand you've done work for Suhakam focusing on prisons, immigration detention centres, as well as pusat serenti or drug rehabilitation centres in Malaysia. Now, when it comes to conditions that could potentially contribute to the spread of infectious disease, what have you found? What have you observed?
Thank you, and Samai Raya.
Oh, thank you.
Prisons are overcrowded, immigration depots are bursting as it seems, so while even during normal times, it is a tough ask for minimum standards for health care because of the overcrowding of about almost 30% in prisons and also in the immigration centers. So I think the overcrowding is the largest issue when we talk about handling this pandemic, this COVID situation. Plus, also some prisons are very old. Some immigration depots are also very old, and so water could be an issue, sanitation, hygiene, clean conditions. And so I think it is really tough for the authorities to ensure that COVID doesn't spread in these places. So, but if it gets in, like now we know it's got in, it's really going to be tough to maintain and to ensure that it doesn't spread widely like what it can do, like in Singapore.
Gerald, I want to ask you about, just to give us a sense of what the conditions are like. You said maybe in some older prisons, not enough running water available or easily available. What about the room situation. How many prisoners are packed into a room? And, you know, would this apply to the drug rehab centers? Would it apply to even the lockups in our police stations?
Actually, every prison, every cell is gazetted by law, and it has a number attached to it. So I can give you an example. I visited the Taiping prison cell. It was designed for, I mean, you look at the conditions, at most 3 people can sleep, but I've seen 5-6 persons there. You can imagine Sungai Buloh, designed for 2,000 plus, it's holding 4,000 plus now, similar to Kajang. So whatever was designed as per law, they have no choice because there are more and more sentient coming in. So that means the numbers have doubled in some of these high-intensity prison because of the numbers of people coming from the courts. So immediately you will ask questions about would they have enough space to move around? Would there be enough officials to manage such a large number? Would the water supply to these prisons were designed for half the capacity now, with double the capacity? Would they be able to address enough water, drinking water, cleaning, cleanliness? Yeah.
Well, Gerald, just before the break, we spoke to a former Director General of the Prisons Department, Tan Sri Zaman Khan, and he mentioned that some prisons, there's only one doctor on the premises. Now, what has been your observations about health services in prisons? Are they adequate to prevent and anticipate infections and diseases, or even treat them?
Actually, we are very glad that there is a doctor placed permanently in all prisons, as opposed to an immigration detention facility that there's no doctor, there's just a medical assistant. And a doctor in these centers have 2 or 3 assistants, but it's never enough because the numbers are huge and the numbers have increased. But it is so good to have a facility, to have a full-time trained doctor as part of the services who can respond immediately and do checks. And every prisoner that goes in gets checked before they are registered inside. So, I mean, there is a protocol, but whether it's adequate or not, I mean, that's something that we can already guess, knowing the 35% overcrowding. So it's definitely not adequate. And medicine will also be scarce because of the numbers. And also the biggest issue we have seen is scabies in almost all prisons. Whenever we visit, the prisoners just come and show us their itch and all their scratching, and because of scabies. And scabies is caused by a mite, and it's actually about clean environment, drier, not damp. But it's cyclical. I mean, you can clear it up, but the mites will still be there. So this is already shows the conditions of how difficult it is for common medical issues in the prison or the depots.
Gerald, you know, there was an issue of tuberculosis, and of course we also know that these diseases, because they're so infectious, don't infect only the inmates, they actually also expose the staff to infections. What can you tell us about that tuberculosis situation in our prisons?
I think you're right. The danger of any infectious disease, any disease can impact officers as well as the prisoners or the immigration detainees. Tuberculosis, all prisons and even the detention facilities will then isolate them to a separate cell. So I think there's a protocol that they are following once they find out someone has TB. But this is when you know and you find out. But I know prisons then will, even despite their overcrowdedness, they will then isolate patients away to an end, to a corner, to a separate prison that does not interact with other prisoners. So I think despite the difficult conditions they are trying, and I think, some officers have also contracted TB or some other diseases inside as part of their work. So they are not immune to this.
Well, in the concern of addressing COVID-19 and addressing and stopping the spread of the disease, many public health officials have raised the alarm around the centers, prisons, drug rehabilitation centers, immigration depots, and they've also advised against incarcerating MCO offenders. Now, I'm just wondering whether now the DG of Health has actually pointed out that this is a high-risk area, high-risk population. Whether it's too late that authorities are acting now, whether we should have been including prisons and all these centers, detention centers, in our public health response from the start, from the very beginning.
the immediate concern when COVID outbreak happened, Suhakam had our consultations and sent letters advising prisons, police, immigration on our worry and some proposals on how to decrease the numbers. Prison was very forthcoming. They were very proactive. They even proposed to the government to limit the numbers, to contain it. Police said they are working on protocols at the lockups, which we have seen instituting. But the immigration depot, initially we heard the depots are closed, so no one goes in or goes out. We thought, okay, that's a good way to manage COVID. But then comes the operations to arrest people in the EMCO, and we thought that was not necessary. While it was legal to do so, and the law is on the side of government because people without documents, but what is the necessity? What is the urgency for such action at this point of time? Because the most fundamental issue now is public health, and we wanted always to ensure that whoever has disease outside doesn't bring it in, and people without documents are already vulnerable and afraid of authorities. This is not a justification that people should be allowed to live without documents here. It's an offense. But at this point, if you are afraid to come forward to a medical officer for treatment, that's a danger for all Malaysians and all in Malaysia. So we thought it was a wrong move. And immediately after the 3 raids done, you see the numbers spike in the 2 or 3 detention facilities. And I'm happy to hear the numbers have gone down today.
Yes.
I'm really hoping it will not go up in any other centers.
We're going to keep a close eye on those numbers. Gerald, thank you so much for speaking with us tonight. Unfortunately, that's all the time we have for you in this episode of Consider This. I'm Melissa Idris.
And I'm Sharad Kuttan, signing off for this evening.
Thank you so much for watching, and good night.